Specialist for Wisconsin Health Literacy. That's the arm of Wisconsin Literacy. Caitlin joins Wisconsin Health Literacy as the health communication specialist because her background is working in a healthcare setting where she was an advocate for health literacy in her community, and she led health literacy efforts at the organizational level. She appreciates the work that nonprofit organizations like you all do to contribute to communities, and is excited to commit her focus to the health literacy profession. Caitlin holds a bachelor's of science in marketing from the University of Wisconsin-La Crosse. And Caitlin, it is all yours.
Great, thank you, Marcia. Good afternoon, everyone. I really appreciate you joining today's discussion on finding reliable health information online. And we're taking this more in a training series as far as how to disseminate this program with your learners in your community, and having that outreach on finding reliable health information online. So our agenda for today is we're going to just do a very brief overview on health literacy and digital health literacy, and kind of some of the backbone of the work that helped develop this program. Some communication techniques you can apply to the workshop, and just talking with whether it be community members, patrons, whoever it may be that you work with on finding information. And then review our community-based workshop and where we're at with getting some community member feedback. We have been doing pre and post surveys, so we'll just look at that. How to facilitate health online in your community, and then provide some follow-up resources for you to check out at the end as well. So I know many of you are familiar with Wisconsin Literacy, but just a little bit more about our branch with Wisconsin Literacy. We are a statewide nonprofit, a part of the organization, and we do a lot of education and training on health literacy, breaking down barriers and miscommunication, and working with providers, healthcare professionals in many forms, whether it be at the doctor's office, insurance agencies, educators in the health profession, on ways to deliver good messaging for patients and community members. And then my part of the work really focuses on this here's community projects, and I love what I do. I pre-COVID was going out into the communities and doing a lot of the workshops, which I've had the pleasure of working with Eric Johnson on the call here, I see, and many other literacy members, organizations that Wisconsin Literacy serves. And it's so rewarding to be able to go out and talk on different health topics, such as like safe medication use or the flu. And we have some new upcoming programs as well. So I encourage you to follow our website or get on our Health Literacy Digest list if you're not. And we always promote the upcoming programs where we can facilitate these programs with you, either myself or another team member, and we've been able to do them successfully virtually now over the past year. So that's been really nice. And then also to check out our Health Literacy Summit every other year. The next one will be in April of 2022 in Madison, and we're going to be at a new location this year at the Edgewater. So if you're familiar with the Monona Terrace, we are switching it up this coming year. And just here for some visual learners, this is our work out in the community and in our settings. Kenosha Literacy Council here, we're doing safe medication use. We've been at senior meal sites located here in the Marquette County area. Over here in the Ladysmith Senior Center, this is our health online program in the works. I'm working with an adult learner on an iPad. And then we also, here's our health summit that we host in Madison, I was mentioning. And we also do a lot on the national level, and working with the Science of Engineering and Medicine on their roundtable, or presenting at many conferences and just advocating for health literacy and promoting those techniques and practices in the work that those in the health profession do. So I am going to start you off with a little quiz, get our brains going, and I would like you can either unmute yourself, type in the chat box. If you're familiar with the annotate feature on the top of your Zoom navigation bar, it looks like a pencil and it says annotate. You can always just put a star next to your answer. I want you to think about which of the following is the single strongest predictor of an individual's health status. Is it A, or 1, age, 2, income, 3, literacy skills, 4, employment status, 5, education level, or 6, racial or ethnic group? Any guesses? Okay, we have income, literacy skills. Great. I see a couple using the annotate feature for literacy, income. Okay. Annotate literacy. Thank you all for your feedback. That was great. So given today's discussion on health literacy, it is, I have one more in the chat on literacy. It is literacy skills. It does dictate a lot and help us move forward in what we can comprehend and decide on those actions to make healthy decisions or certain healthcare decisions. And then we are faced with this gap of reading levels. So 1 in 5 read or at the 5th grade level. Most healthcare information is written at a 10th grade level or above. And I can say personally, I have my background in marketing, and I used to work at a hospital where I was developing brochures and online materials. And before I was aware of health literacy, I worked with doctors, and I thought I was really taking what they would send to me in their jargon and making it understandable for patients and community members. When I did our information in a readability test, the information I had been taking from the doctors and the healthcare professionals was still at 11th grade reading level. So I thought I was doing a good job, and I clearly wasn't. And there's a lot of great tools out there on readability that you can access in looking at that information. And then I want to do this plain language exercise. So this is one of the techniques in helping with that readability level, is thinking about what are simple words that we can use to replace our jargon. And in the work that you do, this is not just healthcare. This is in literacy, and you may be well aware of ways to simplify things. But in any profession, whether it be a car mechanic, a dentist, a beautician, think of the way the words that you're using in everyday work settings is not always clear to those people that we're helping. So what could be another way to say prevents osteoporosis? And I'll give you a few moments. Again, you can either say it out loud or use the chat feature. Stops bone disease, stop bone loss, great. Prevent bone loss. So yeah, or you can say keep bones strong. So that's, stop bone loss is also another great one. I would say prevents is still, you can still get that more simplified. So just think about when you're in the doctor's office and the doctors throw these words at you and you're like, come again, what did you just say? So that's what we want to do within our work settings and practice and the messages that are being spread. Here's just some words that we use in everyday language. So again, additional, utilize, in the event of, in lieu of, due to the fact that, and at your earliest convenience. You know, many times this is written in email and, you know, it's just maybe sounds a little more proper, but let's just be clear and use more, use, if, instead, because, as soon as you can. So, you know, sometimes it's just easier to think this way, but sometimes you really have to think about the way that you're used to talking and simplify those words. But health literacy is more than just plain language. And this video clip has been shared widely, but I want to play it. I'm not going to play the whole video, just giving our time. And I want you to just put yourself in these patients' perspective of medical experiences they faced in experiencing low health literacy.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. And when they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what I recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That's twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered.
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
Great. So I encourage you to watch the rest of that video if you haven't seen it yet. It's by the American Medical Association, and it's on our website. But really, if you were following those titles that were displayed from the participants, various reading levels, various professions, you know, and you can't always just tell by looking and knowing what they are comprehending and understanding to make those health decisions and more importantly, take medicine, right? And how crucial is that when taking medicine? Because one mix up in reading, for example, once, you know, we're working on labels right now so that once is not written anymore on labels, because in Spanish, that translates to once. And when you have take 1 time or take 11 times, that can put somebody in the hospital with that, you know, language barrier and not understanding how many times they should take their medication or when they should take their medication. So that's just a very brief glimpse of why we're doing the work we're doing in health literacy and why it's really important to break down those barriers and address these divides of misunderstanding. So there's really 2 sides of health literacy. It's one, a person's ability to access, understand, and use health information. So it's the learners that you work with too. You know, this can be applied to the settings as you being a communicator and educator. The person coming to you, do they have the ability to access this information? And how are they understanding based on their literacy levels? And then do they understand enough to use that information to make good health decisions? And then the other side of that is the health professional, the doctor, the nurse, the educator, and their ability to clearly communicate how to access and understand and use the health information for better health. So it's both people together, working together, that makes good health literacy. Again, health literacy means a person is able to understand, one, instructions on a prescription bottle, okay, understanding how to take that medication clearly. There was an example from someone, the wife was giving their husband an antibiotic for an ear infection. Well, it just said, you know, give this medication 2 times a day. It didn't say where to give the medication, how to give the medication. So with an ear infection and giving the tube droplet, they were placing the antibiotic in the ear instead of in the mouth. So just a mix-up in medication and how it's given makes a big difference. Understanding what the doctors say to them, okay? And this can verbally, written. Nowadays with COVID and a lot of information is through telehealth, that you have to consider what barriers they face in, one, the doctors reading body language, and then 2 is, are they having good internet connection? Are they getting all the messaging? The emails that are sent to follow up, do they understand those? And then appointment slips. Do they know how to get to the appointment? Do they know how to read the time? Medical brochures, the consent forms. Do they know what they're signing? And then there's this whole other gamut of insurance and understanding what is a copay, a deductible. Do they know how to do calculations? Do they understand who accepts their insurance? Or if they go to a different location, they might not be covered. So those are all things to consider when a person might not be understanding these and experiencing low health literacy. So now that we've had just that brief 10-minute overview on health literacy, let's think about that and understanding information online, right? So think about, I just want you to think to yourself of maybe ways that you have applied searching for information online, whether it be finding ways to get healthy, maybe healthy recipe, maybe you need to look up some exercises, or your child comes to you and they have a rash that's spread all throughout their body, you've never seen it before, or you want to shop for the best health insurance. What do you do? And feel free to share that in your comments or talk out loud if you would like.
Most people Google it.
Google it, yes. And yep, I think maybe that's what the other person had said. I couldn't quite hear clearly. But yes, I'll transition right into that comment. Google. Google has become the new norm. Over 1 billion people search Google for health information every day, okay? And this is according to Pew Research. There's a lot of great research done by the Pew Research Center. And that's a lot of people looking just on Google alone. And think about how many other search engines there are out there. Or maybe they're just going directly to a website. So a lot of people are going on these websites to look up health information, which has now termed itself Dr. Google. We use that in our marketing because it's really become the new norm for users to just search on Google and look up that information. And this is back in 2013 from Pew Research. 81% of US adults were using the internet then. And over half of US adults looked up information online. Okay, so now fast forward to 2021, you can only imagine, and especially within this past year when you're isolated and relying on technology, how many more people are using internet. According to Pew Research Center, roughly half of US adults, 53%, say the internet has been essential personally during the pandemic to get that information. So with health information only increasing in line, this has a huge impact on a person's health decisions. 50% of health searches impact that person's health decision. And especially here in the US, that is huge because they're part of that patient-centered decision making, right? Doctors are saying, well, this is what you have. How can we work together to make that health decision? So what are patients doing? They're going online to look up more research and getting that information. But unfortunately, we are faced with this digital divide among seniors and those with low health literacy. So we know there's this large gap of those that experience low health literacy, and only 15% of adults experiencing below basic health literacy find health information online. While those more proficient, approximately 62% of adults with proficient health literacy use online resources. So you can see there's less that have low health literacy using online resources when there's more that have proficient health literacy use online resources. And this is based on the National Assessment of Adult Literacy. But why is that? Why is there this divide? Well, there's difficulty finding reliable health information online. Navigating and reading can be intimidating. Looking at websites, what website to go to. And then there's this big one at the bottom here is accessing the internet. And this is a huge one. It doesn't just have to be in a rural setting. I've worked in Milwaukee and their centers where there's just overload of people using the internet, and we had hotspots going and it was still not the best connection. So it's not always just in those rural settings that have trouble accessing the internet. Fortunately, this past year, internet access has become more accessibility with some grants and funding that's available out there. And I encourage you to reach out to local libraries to see if there's hotspots that could be used for learners to use, or in parking lots. Many times you'll see people sitting, whether it be in a cafe parking lot, McDonald's parking lot, library parking lot, a school parking lot, accessing their Wi-Fi because maybe they don't have it at home. So there's that difficulty. Here is a quick visual to give you an idea of what intimidation and why there's this barrier with low literacy learners using online resources. So we have this person on the left navigating this web page. And this is called usability testing, where computers can track eyes and watch where the users are going and reading and pausing. And then we have the person on the right, similar website, but a lot more back and forth, a lot more pausing and spending time on the web page. So if you had to guess, which one would you guess is a low literacy learner compared to more proficient literacy learner? Right, whoops, go back. And I didn't see anything in chat. I'll just tell you that it's the one on the right is a lower literacy, right? They're spending more time rereading words, going back and trying to comprehend, make sense of what they're reading to understand the information, where there's a quicker read here on the left from a proficient learner. And I know many of the literacy members and agencies may be housed within a library itself, but I just wanted to point this out because librarians they're just good partners, especially when doing this programming in your community. Librarians are the second most trusted when it comes to finding reliable health information next to doctors. There's valuable information and essential to communities. Really, there's so much out there, being the hub of information or just being that place to go to access the internet again, right? The accessibility. So this has become a hotspot, something to just utilize in your community. And then there's this thing that you need to remember, and more so a disclaimer about providing this information online and working with your learners, that information found online does not replace the advice of medical professionals. And that's really important, because we get learners in these workshops saying, well, you know, I go on because I want to diagnose, or I need to figure out what treatments to give my children and do that. It's really important to follow up, though, with a medical professional after the information found online and say, you know, I've done my research. What do you think is best? And then also, when you are doing these workshops, just say, you know, you're not a doctor or pharmacist or nurse or medical background. Maybe you are, though, so maybe you can advise on this. But clearly, if you are not, this is something you want to point out of, okay, I'm not a medical professional. So what we're talking about today are tips and suggestions, and it's not to give you suggested treatment or diagnosis. So what can you do? Well, there's a lot that we've kind of talked about here in a short time about these health literacy practices. And one of the best is applying universal precautions. Well, what does that mean? That's kind of our own jargon, right? Okay, so I see some questions coming in. And if it's okay, if I to get to these at the end to continue going forward, is that okay?
Yeah, we can address the questions at the end.
Thank you. So and keep them coming. I really appreciate the questions. We want to take this universal precaution approach, and that means, like, don't assume what you don't know, right? Take actions to minimize risk for everyone. So think of why doctors put on gloves here. Why do they wear gloves when they're working with patients? To minimize risk, because you don't know if there's infection, bloodborne pathogens. This past year, COVID, right? The haphazard suits, everything, minimizing risk because of the unknown. So that is one of the way, don't assume everyone knows how to use a computer. Don't assume everyone has access to the internet. Don't assume everyone knows how to read a web page. That's applying universal precautions. And use plain language with everyone. Take those simplified terms. If you see something that's in jargon, just say, you know, it says this, but let me tell you in a different way to better explain this. Here's some more digital literacy strategies, is to slow down. Work at a pace that your learners are at and start at their level, okay? Ask them, have you been on a computer before? Is this all new to you? Do you know how to turn it on? Do you know how to use a mouse? Do you know how to access a browser? Do you know what a browser is? Those are all things to consider before getting online right away and just saying, here's a good website to go to for health information, and then leave them on their own. And then jumping down to this last bullet point here would be hosting maybe a technology 101 training. Get them comfortable with that technology that you're using or that they're bringing in, and saying, I have an iPad, but I don't know how to use it. Okay, well, let's take some time to review those steps. Use Teachback. So Teachback is a practice where we've gone over a lot of information today. Can you tell me what is the best website to go to for reliable health information? And then they can answer, instead of saying, what questions do you have today? Or sorry, that is a good question. Say, do you have any questions today? That leaves it for like a yes, no answer. We want to really limit that when teaching somebody, to not just be able to say, no, I don't have any questions, right? Because maybe they're feeling unsure or a sense of like shame for not knowing, and we don't want to create an environment like that. So just welcome them to come back with, this is what I learned, is it right? And then you can cover that information if you need to more. And then help with accessibility. Again, tell them the resources that are available in your community, where they can get internet, where they can get hotspots, where they can get help getting devices out there. So those are tips to help with your learners. So I would like to take this time. We're going to take about 4 minutes to do a breakout room and talk about what are ways that you are already adapting universal precautions in your environment, in your setting. And then we'll come back and just share those tips and ways that others can apply those as well. And so I think we're going to create a breakout room, which I don't see that. Madison, you might have to do that if that's okay.
I can do that for you.
Okay, thank you. Great. And if you don't want to do a breakout room, that's no problem. If you're not familiar with it, you can just click join on the pop-up box and it will bring you back automatically.
I wish Zoom would make it so you can still share the screen in the breakout rooms. I think that's one of the challenges always with these.
Yeah, because then they're thinking, okay, what are we here for again? Yeah. And I'm just looking at my clock and I think, yeah, at 1:09, we'll give them a 1 minute.
Sounds good.
Warning. Okay.
Oh, I'm gonna broadcast the message. Let's see. I'm just gonna type the question we have here and send that out.
Thank you. Sorry, I didn't realize I didn't have that permissions.
That's been something that's been kind of strange too, is some presenters have been able to do it just being a co-host and some I've had to make full hosts to do it. And I don't know if it depends on like what level their Zoom account is at or
okay,
if it's like an update.
Might be an update. Thank you for doing that. So I heard Marcia say you guys are doing a drawing at the end. So I know this ends at 1:30. Do you need like extra time?
It should just take a minute or two. And if you go to the full thing, that's fine. I can always do it at the end. We're gonna email the winners. So if they need to jump off right at that time, that's okay too. And we've been working with that the whole week.
Great.
I'm still here, Miss Madison. I just didn't want to go to the breakout room.
Totally fine. You get to hear our chatter.
All right, so if you want to send that message for them to wrap it up.
1 minute remaining message.
Yes, that'd be great. Thank you. All right, we're starting to get some folks back. We'll just give it a couple more minutes.
Caitlin, can you hear me?
Yep, we can hear you.
I just wanted to say, I just shared this with my group. You've really incentivized me to ask my student if she understands what we're talking about. I feel like I don't do that enough. And my student recently had a stroke, and she does read. Her reading level is at about 5th grade. And I think I took it for granted that she's understanding everything that her doctor and her physical therapists are telling her. And it's kind of a personal thing. I don't want to get too, personal with her, but you've incentivized me to reach out to her to see if she does need some help with that. So thank you. This has been great.
That's great. Thank you for sharing that, Vicki. So yeah, that Teach Back tool, has there been any other comments or thoughts that were shared in the group about ways that you can apply universal precautions or just ways to minimize risk for miscommunication in your work? Oh, you're on mute, Marcia. Sorry.
There we go. We had a very broad discussion and kind of tied it to how we all had to repurpose what we did when the pandemic hit, and how learning how to use new tools and our students having to learn new tools and making sure we each understood how all that worked. It was really interesting to hear all the changes that people have made with all of those same things in mind.
Yeah, it's a lot it's a bit overwhelming, right?
We all agreed at that too.
A bit overwhelming, all these changes, but everyone's doing the best they can and understanding. So yeah, just taking again that step back and taking things slow, as just assuming this is all new for a lot of people. Great. Any other comments? Well, I appreciate everyone joining those discussions and just sharing your best practices with the group. We are now going to talk about this partnership where we have been facilitating these health online programs throughout the state. We worked with the National Networks of Libraries of Medicine, the Greater Midwest region, to put together this Health Online Finding Information You Can Trust program for learners of all levels, really, especially those underrepresented populations and those at risk for low health literacy. But we've found that this tool can be useful in many settings. Even professionals out there have found something new when tackling this curriculum and learning about it. So our goal is to help consumers, especially from vulnerable populations and those at risk for low health literacy, identify and effectively use trustworthy sources of online health information. Now, there are a couple handouts, and these will be provided to you after the workshop. And then I'll also share a link where they're available online at any time for you to download and reference. But we have these handouts created for participants to get during the workshop. I know it's an online curriculum, but they like to have these handouts to take home. And on the back of handout 1 is a checklist that is developed from the National Libraries of Medicine. And it's good questions for them to go over and evaluate a website. So there's a section in the curriculum where you can go through and evaluate with your learners on a website and go through these questions of, you know, who's in charge of the website? How is the website supported? How is the content selected? So looking at the About Us page, privacy policy, do they ask, the site ask for information, for your personal information? So these are just good, this is a good tool to use with your learners and evaluate just a website. I would not recommend saying you need to do this every time you visit a website because it can be overwhelming, right? Like that's going to take a lot of time. Just get them comfortable with 1 or 2 websites to evaluate so that their mind is processing these questions when they're looking at websites. And then this is the online class, and we have just highlights of the curriculum, and then we have a note section here that learners can follow along. And we developed these resources after piloting it at libraries and patrons there, and this was really important for them to have sections to follow along and write their own notes during the class discussion. And at the bottom here, you'll see is the URL wihealthLiteracy.wixsite.com/healthonline. So you'll have access to the online curriculum to access at any time. The workshop is a community-based workshop. Here is Deer Park Public Library that we were at working with a group of seniors. Really need the full 90 minutes, if not more. I think this session, what we had originally planned for the grant was to do a 90-minute workshop. I think it could work well breaking this into different sections and taking your time based on the learner's ability. If you're going to be doing it in a large group setting, maybe just dedicate 2 hours for the workshop really, so that there's time for questions, and technology always throws us with some glitches and all that. So it gives you a comfortable time where you're not speeding through everything. There's a facilitator script that will guide you through the whole curriculum and talking points and learning points. Hands-on learning. So again, offer a space where you can work on technology or recommend for the learners to bring their own devices that they're comfortable with is a great tool. And then again, resources to take home with those handouts. So I am going to now show you the online program. I'm going to have to probably share my screen again. Are you still on the, okay. So this is the program, Health Online, Finding Information You Can Trust. Again, it's the Wix site you can access anytime. And it goes through the talking points. What are we going to talk about today? So start with that. And again, the facilitator script guides you through using this whole curriculum. We've already talked about the importance of doing that disclaimer at the beginning. It goes over common web terms. And this is, again, base it off of your learners' learning levels, comfort levels with technology. Don't assume they know all these words because they are discussed throughout the program. Ask them what they know. Open it up for questions. How can using online resources be helpful? And then you go over searching for health information. So this is where we talk about search engines, searching on websites, search tools for privacy. So this is new, and this might be new to you as well. There are privacy browsers out there that allow you to do searches that are not tracked and really limit the advertising that's done. DuckDuckGo, I want to show you, is a privacy search engine. It's not a browser. So just the searches you do on this search engine is going to be private. Okay, so this is, thank you, Madison, for sharing that URL in the chat feature. The chat box had the health program URL. So the DuckDuckGo is, again, it just stops it. So if you were looking up, you know, healthy recipes for chicken, the next day you go online, you're not going to start to see chicken coupons or chicken related searches that maybe you don't want tracked. Where Google does a lot of tracking to personalize your searches, so that if you are somewhere and you're searching Madison fish fries, it's going to give you maybe advertising for restaurants in Madison, or fish fry recommendations, and it tracks you so that maybe it's going to show up on your Facebook page, or maybe it's going to show up on your other Twitter pages or whatnot. So that's what Google does, where DuckDuckGo does not. And then there are, going back to the health program, is there's a browser, and this is an example of the Incognito Browser. And to get to that, you see the drop down. I have 3 drop down dots, and I'm able to go New Incognito Window. And when I click on that, I see a browser that is similar to the screen here. So it will be in private. And this is nice, especially if someone is wanting to fill out health forms, right? Put in personal health information, make payments, and do that. So there's a lot of good ways and reasons of doing this Incognito browser. There's also Firefox, Internet Explorer, Safari has a privacy browser. So throughout many of the browsers, you can have this privacy tool. You talk about these other specifics. And then there's tools in here for you to have the learners try searches themselves, okay? And so it guides you through on how to do these searches. And I'm just gonna briefly skim over this learning curriculum on how to read a web page, why you should do it. Again, don't assume they know how to read a web page. Do they know where to start? Do they know how to navigate through menu bars? And checking for hyperlinks. So this is a one where many are interested in, how do I confirm I know what I'm clicking on? Well, you see it goes from an arrow, and then if you pay attention to this bottom left center, or this bottom left corner here, when I hover over this hyperlink word, do you see that URL pops up? That's confirming I know what I'm clicking on, okay? So it goes through other ways to check for credibility in the About Us sections, checking bottom of web pages for dates. We say if a website has not been updated in the past 5 years, it's probably not being managed or maintained, so that information is probably up to date. And when you talk about health information, it really should be up to date. Domain differences. Be very cautious of .com, because .com, anyone can create a .com website, where more trusted websites going to come from .gov, .org, .edu. And then so checking the bottom of websites for credibility, and I'm just going to use our Wisconsin literacy page here, is this copyright, and that will show you the date of it being up to date. Okay, so look at the bottom of the web page. Again, it shows a physical address. They have contact information. And then I can also show you, I'm going to get to these reliable websites. I want to show you this list. There's a tool to compare websites and comparing for information. I want to show you, though, the websites that we recommend going to and just kind of go over those in detail. So Medline Plus, and I click on that. Here, Medline Plus is through the National Libraries of Medicine. Okay, this is one of the top health sites that I would recommend learners to go to. One, it's very easy to use. Okay, this is just all the information on the home page, unlike some other ones where you have to scroll down through a lot of information. There are no advertisements on this website. If you have advertisements, it does not mean the website is bad, but just be cautious of what they are promoting in those ads. Are they trying to sell you win a car by clicking on this link, or lose 20 pounds in one day by taking this miracle pill? You know, those are far-fetched ads that tells you a lot about the website and the information they're sharing. It's not reliable. So those are probably websites you don't want to use. Where Medline Plus, though, does not endorse any products or services. It's just a very clean website. The bottom of the page here, again, has the date. We can click on the organizations that support the website. So when I click on it, it takes me to the National Libraries of Medicine website. I know it exists. It's not hiding any information. It gives me an address, okay? These are things that I want to pay attention to when I'm looking up information. And then there's the About Us page. The About Us page gives so much information about the websites and really takes you through in detail about the information you're looking at. So it's the world's largest medical library through the National Institute of Health. And it just goes over so much information. It's not hiding information. Again, I encourage you to check out this website and browse through it after today's discussion. The CDC website. So this website is for the Centers of Disease Control and Prevention. It's a great website to talk about diseases and world diseases and statuses of those, especially with COVID. It gives you travel notices and related to COVID in other countries and maybe other outbreaks that might be happening in those countries. So the CDC is a great website. Mayo Clinic. Again, this is a world-renowned hospital where they have patient information. FamilyDoctor.org. I want to show you this website because there is a really neat tool. It's called the Symptom Checker. And many learners say when they have symptoms, what they do is Google it. So if I click on this orange box here, I can actually go to this website and look at so many different symptoms, you know, a cough, just a very common cough, okay? And it walks you through, you know, are you short of breath? Does your, you know, have mucus? And there's so many questions to help you get more specifics on possible causes. And then that's something, again, talk with a doctor about after you've done the symptom checker. Healthline.com is similar to Medline Plus and Family Doctor, but it's a .com, so there's going to be more advertisements, but there are physicians and doctors that are backing up that information. Healthcare.gov, that's to find the marketplace and to find health insurance information. Medicare, for those that need Medicare services. And then here's another really neat one that just outlines, it's through the Medical Library Association, and it outlines websites based on health topics, and it goes over so many websites. there's some websites for people in Wisconsin, and I know we're just wrapping up here at 1:30, so I want to finish up this information here. This website, though, it's been very useful for many about legal questions, maybe difficulty in health systems, maybe had a health experience they have questions about. This patient partnerships is through the UW-Madison. They give a contact us page where they have patient advocates that are there to help patients through maybe some troubling times, legal, financial questions, and guide them through health information. Okay, so this curriculum, again, it goes in depth. There's many websites, a lot of information on here. Websites in other languages, which is another useful tool. I just want to share that really quick back on Medline Plus. They have over 50 languages with translated information on their website. Again, I cannot say enough about this website. It's really, really great. So I'll wrap up here going back to our PowerPoint. And here's just some information on what we're finding, that people want information on symptoms, help scanning websites. So that's reading web pages. Here's just some information on what helped create our curriculum based on age differences. And I can share these handouts afterwards as well, the PowerPoint with these statistics. Just our program was successful in reaching objectives and most importantly, helping those learners feel confident in finding good health information online. So to get involved, again, become familiar with this online program, bookmark Medline Plus, host a workshop. You can learn what websites are reliable in your practice, get familiar with that. And then the biggest one is partner with community organizations to pull in other community participants.